Okay, good morning, everyone. My name is Kenny Wu, and I'm the program coordinator here at Wildcard CTSC. Thank you, everyone, for joining us today. Today we're joined by Natalie Helmers, Mesa Trabilsi, Gabriel Auerbach, and Samantha Barkin from the Wild Cornell Parkinson's Disease and Movement Disorders Institute. This presentation will be done in English and Spanish. If you want to ask any questions or you want to talk to the presenters, there's a chat function at the bottom of your screen. You can type in a question, and at the end of the presentation, there will be a Q&A session where they'll be answering the questions, okay? We will also be recording this presentation, and you can find us the presentation on our YouTube channel. Muy buenos días, mi nombre es Kenny y yo soy el coordinador de programas en Wild Cornell CTSC. Muchas gracias a todos ustedes por atender nuestra presentación el día de hoy. Vamos a tener una presentación sobre el uso de la tecnología en la enfermedad de Parkinson. La presentación va a ser en inglés y español. Si tienen preguntas, en la parte de abajo hay una sección donde nos pueden enviar un chat o un mensaje. Las presentadoras del día de hoy son Mesa Trapilsi, Natalie Helmers, Gabriel Auerbach y Samantha Barkin, del Departamento de Neurología en Wild Cornell Medicine. Al final, vamos a tener una encuesta sobre la presentación. Por favor, llénenla si pueden.
Good morning, everybody. This is our third presentation with the CTSC. Our previous presentations can be found on YouTube. Welcome. Our sessions are being recorded. Please listen to the following presentation. All questions will be addressed at the end, and you can share your questions by speaker or by chat feature, as Kenny had just mentioned.
Bienvenidos. Esta es nuestra tercera presentación con el CTSC. Nuestras presentaciones anteriores pueden ser encontradas en YouTube. Esta sesión va a ser grabada. Si tienen preguntas, usen la función de chat y sus preguntas serán respondidas al final de la presentación.
So just to formally introduce myself, I'm happy to see many familiar names and faces present with us today. My name is Natalie Helmers, and I'm a nurse practitioner at Weill Cornell Medicine. And I'm also in a PhD program working on my degree in nursing research. A fun fact to share about myself is that, and of course, anybody who was with me last year in the Parkinson support group may remember this, talking about Thanksgiving food, and my favorite dish for Thanksgiving is preparing a variation of squash.
All right, so my name is Mesa Trabilsi, and I am a research coordinator that works with Natalie in neurology. I am an aspiring physician looking to start medical school next year. And a fun fact about me is that my favorite food is a New York slice of pizza.
Con nuestros presentadores del día de hoy, tenemos a Natalie Helmers, que es una enfermera practicante. ¿Y sabías que su comida favorita para preparar el Día de Acción de Gracias es la calabaza? También tenemos a Mesa Trabilsi, es una coordinadora de investigación y es una médico aspirante. ¿Y sabía que su programa favorito de televisión es The Office?
Hi, everyone. My name's Gabrielle, and I'm also a research coordinator with Natalie and Mesa in our department. And I'm also getting my master's at Weill Cornell Medicine in health policy and economics. And a fun fact about me is I'm a 200-hour certified yoga instructor.
Hi, everyone. My name is Samantha. I'm also a research coordinator here at Weill Cornell. Like Mesa, I'm also an aspiring physician, and I hope to start medical school in the fall of 2021. A fun fact about me is I was a college softball player, and I played first base.
Aparte de Natalie y Mesa, también tenemos a Gabriel Auerbach, que es una coordinadora de investigación y también es instructora de yoga certificada. Y también tenemos a Samantha Barkin, que también es una coordinadora de investigación y era una jugadora de softball en la universidad y jugó primera base.
Our objectives for today's talk include an overview of Parkinson's disease, treatments and symptom management plans available for Parkinson's disease, a look into the technology involved in healthcare management and Parkinson's disease, and technology-based clinical trials here at Weill Cornell Medicine.
Los objetivos del día de hoy. Lo primero, vamos a dar una descripción general de la enfermedad de Parkinson. Vamos a hablar sobre tratamientos y planes de manejo de síntomas disponibles para la enfermedad de Parkinson, la tecnología utilizada para la enfermedad de Parkinson y, al final, los ensayos clínicos en Weill Cornell Medicine para la enfermedad de Parkinson.
So to begin with our overview of Parkinson's disease and what it is. So it is a progressive nervous system disorder that affects both motor, which is the movement, and non-motor symptoms. And you'll be hearing these terms throughout the talk, right? So motor refers to our movement, and non-motor symptoms refer to everything else.
Una visión general de la enfermedad de Parkinson. La enfermedad de Parkinson es una enfermedad progresiva del sistema nervioso con síntomas motores o de movimiento y no motores. Los síntomas comienzan gradualmente y generalmente como un temblor y empeoran con el tiempo.
From what we know of the possible causes of this disease, we do know that neurons in the brain gradually break down or die, and many of the symptoms are due to a loss of neurons that produce a chemical messenger in your brain. And this is that famous chemical messenger, dopamine. When dopamine levels decrease, this causes abnormal brain activity and thus leads to the symptoms of Parkinson's disease. And here's that image of the brain, the very, very deep part of the brain where we see this disintegration of dopamine.
¿Cuáles son las posibles causas de la enfermedad? En la enfermedad de Parkinson, las neuronas en el cerebro se descomponen o mueren gradualmente. Muchos de los síntomas se deben a una pérdida de neuronas que producen neurotransmisores llamados dopamina en el cerebro. Cuando los niveles de dopamina se disminuyen, esto causa una actividad cerebral anormal que en torno causa los síntomas de la enfermedad de Parkinson. Los neurotransmisores son biomoléculas que tienen la misión de transmitir o alterar la transmisión de información en el cerebro. Y aquí hay una imagen en el cerebro, en la parte de la derecha.
Overall, the causes are unknown, but we have multiple suspicions where we believe that the several factors that appear to play a role in the causes include your genes, age, and sex. And there are multiple environmental triggers, for example, toxins. These causes can lead to deposition of abnormal amounts of normally produced protein, something called alpha-synuclein in the brain.
¿Cuáles son las posibles causas de la enfermedad? No sabemos las causas, pero hay varios factores que deben ser considerados, como por ejemplo tus genes, la edad y el sexo. Aparte de eso, también hay desencadenantes ambientales. Ejemplos son las toxinas. Estas causas pueden conducir al depósito de cantidades anormales de una proteína producida normalmente en el cerebro llamada alfa-sinucleína.
To review the motor symptoms of this disease. So there can exist a tremor, which is an involuntary movement, bradykinesia, which is defined as slow movement, and also rigidity, where the muscles actually get stiff. So again, remember these new terms, right? Bradykinesia, rigidity, and tremor. And the image to the right, which encompasses some of the things that can happen that are part of the overall condition, right? So some people might have a masked face. There may be tremors anywhere in the body, could be the arms, could be the legs, could be in the hands. And as the image below implies, there can also be a shuffling of gait, where the steps actually become much shorter. And people can experience a variety of these symptoms.
Entonces, los síntomas motores de la enfermedad de Parkinson, hay ejemplos como el temblor, movimiento involuntario, la bradicinesia, es lentitud de disminución de la amplitud de movimiento, básicamente, qué tanto uno puede moverse, los músculos rígidos y complicaciones motoras. En la imagen hay ejemplos de, de los síntomas de la enfermedad de Parkinson.
For some of the non-motor symptoms of this disease, we know there can be constipation, there can be insomnia or poor sleep, REM sleep behavior disorder, where a person actually acts out their dreams, a loss of sense of smell, and it could be a general loss, or a person might lose their sense of smell completely, mood changes such as anxiety, depression, or other mood changes, excessive saliva, and also cognitive changes.
Entonces, síntomas no motores de la enfermedad de Parkinson incluyen constipación, el insomnio, el trastorno del comportamiento del sueño REM, pérdida del sentido del olfato, ansiedad, depresión, cambios de humor y producción de saliva en exceso.
The Parkinson's disease is a clinical diagnosis at this point. It's based on medical history, signs and symptoms, and an actual physical neurological exam. Brain imaging may be obtained, but that's usually the case if there's possibly some confusion in how the symptoms are presenting. There's officially no biomarker to diagnose Parkinson's disease.
¿Cómo se diagnostica la enfermedad? Es un diagnóstico clínico que incluye su historial médico, signos y síntomas. Aparte, se da un examen neurológico y físico, y a veces también es un diagnóstico por imágenes.
Treatments of the disease include medications, and now I'm happy to report that there's multiple ways of attaining the medications. Can be orally through capsules and tablets. There exists an inhaler for Parkinson's disease. Also, medication can be injected, and there's also a pump. When symptoms become more and more complex, deep brain stimulation is a surgical procedure that can be offered. Treatment of this condition also very much includes exercise and diet. And then, of course, there are clinical trials, and this is where we come in. And we have a couple of technology-based protocols here at Weill Cornell that we will be sharing with you shortly.
¿Cuáles son los tratamientos para la enfermedad de Parkinson? Que incluyen medicamentos como las cápsulas y tabletas. También hay inhaladores, inyección y bomba, el ejercicio y la dieta, y procedimientos quirúrgicos como la estimulación cerebral profunda, DBS por sus siglas en inglés, y ensayos clínicos que al final de la presentación van a hablar.
And to talk about how treating Parkinson's has changed over the basically last few decades. So at this point, a patient may actually be treated by multiple different healthcare providers. And this image here just shows some of them. So while there are actually 13 different providers listed in this image, that might not be all. a patient with Parkinson's may be seen by a neurologist. They may be seen by a sleep medicine specialist if they have sleep issues. There may be occupational therapists, physical therapists, speech therapists that are involved in the care, depending on what, some of the symptoms that a person is facing has endured. Additionally, if you look really closely here on this image, there's a key player that's not been listed, and that's partially done on purpose to kind of bring to awareness that the primary care provider is often missed in this, really busy care treatment plan. More and more patients are finding it difficult to have a primary care provider or find a primary care provider, or maybe they've just been so occupied with their neurological care that the holistic part gets missed. So again, as the years have revolutionized our care, there really have become, there's so many different roles that are involved.
¿Y cómo ha cambiado el tratamiento de la enfermedad de Parkinson? Un paciente puede ser tratado por varios proveedores de atención médica o sanitaria, como por ejemplo un médico de cabecera, neurólogo, urólogo, cardiólogo y psicólogo, ¿no? Hay muchos proveedores de atención médica el día de hoy que tratan la enfermedad de Parkinson juntos.
And what has also changed is how healthcare information is being managed. So the electronic health record in hospital systems have been evolving and upgrading over the years, including here at Weill Cornell. And a person may be managed by many different teams and providers, as was just shown in the previous slide. And those providers may be located in different systems, right? So your physical therapist might not be practicing in the same system as, let's say, your neurologist, or maybe your psychiatrist is not working in the same system as your primary care doctor, which hopefully you have one. And so keeping one's health information organized is extremely important, and that's important for the patient. So as a patient, you yourself need to stay organized, even now more than ever, because there are so many different people that may be involved in your care. And also those care providers need to make sure that they are communicating accordingly. And again, the future vision of the electronic health record is to better streamline all this information. And so when you go to your healthcare visit, certainly make sure the information is up to date. Keep notes. So here on the left is the image of what a motor journal looks like. And really, make sure that all your providers are communicating with one another. And certainly it's the role of the healthcare provider themselves, speaking as a clinician, that for future good care, everybody has to be on the same page.
¿Qué más ha cambiado el manejo de la información médica en el presente? El Electronic Health Record es un sistema hospitalario que ha ido evolucionando y actualizándose a lo largo de los años. Una persona puede ser administrada por muchos equipos diferentes en diferentes sistemas hospitalarios. ¿Por qué se usa? No, es para mantener organizada la información de salud de uno, es muy importante, y también hay que asegurarse que su información médica esté al día.
So one of the ways the healthcare field is moving in order to incorporate all of your different physicians is by incorporating technology into healthcare, especially during this time of COVID. So physicians have moved towards telehealth visits, so using Zoom, FaceTime, or a portal technology like we have here at Weill Cornell called Weill Cornell Connect. This allows you to see your physicians from home. And at Weill Cornell, We have the portal where you can message your physicians, you can request medication refills, and you can schedule visits. There are also remote monitoring tools that I'll talk about in a little while that allow you to collect your data at home and securely transmit them to your providers so they can review them and make recommendations without you having to come into the office.
¿Qué otras tecnologías hay en el cuidado de la salud? Por ejemplo, la telesalud son visitas virtuales realizadas de forma remota mediante una plataforma online. También hay tecnología portal, como por ejemplo Wellcare Medicine Connect. Y estas son herramientas de monitoreo remoto. Un ejemplo aquí, marcapasos, ¿no? Que transmite datos a un centro remoto y es usado para recompilar datos médicos de pacientes y para transmitir información médica de forma segura a los proveedores de atención médica para evaluaciones y recomendaciones. Y este es un muy importante recurso para disminuir la tasa de readmisión.
So some of these remote monitoring tools include sensors and wearable technology. So some might be smart health watches like an Apple Watch or a wearable fitness tracker like a Fitbit. There are also wearable ECG monitors that can measure your heart rate and heart rhythm. There are remote blood pressure cuffs that can monitor your blood pressure. There are also biosensors, which will generally be taped to either a lower back or an arm, and these can measure heart rate, respiratory rate, your temperature, and collect all of your movement data, which is very relevant for Parkinson's patients.
Aparte de eso, también hay sensores y tecnologías portátiles, como por ejemplo los relojes de salud inteligentes como Apple Watch, rastreadores de estados físicos portátiles como el Fitbit, monitores ECG portátiles, monitores de presión arterial portátiles, y también hay biosensores, básicamente son parches autoadhesivos que permiten a los pacientes moverse mientras recopila datos sobre su movimiento, frecuencia cardíaca y frecuencia respiratoria y temperatura.
There are also smartphone applications that you can integrate into your daily life that might help in scheduling your own healthcare. So there's an app called ZocDoc, which will help schedule appointments, MediSafe, which is a medication reminder application, Amwell, which can help you find an urgent care facility, and Talkspace, which is an online therapy platform.
Hay varias aplicaciones para teléfono. Las aplicaciones más populares entre los pacientes, por ejemplo, hay ZocDoc, es un sistema de programación de citas, MediSafe, una aplicación de recordatorio de medicamentos, Amwell, una aplicación de telesalud para visitas de atención de urgencia, y Talkspace, una plataforma de terapia en línea.
All right, so let's talk about some gadgets in Parkinson's disease. Our first gadget is called a personal kinetic graph, or a PKG for short, which is basically a wristband that a patient with Parkinson's disease wears on their most affected side. So for example, if a subject's most affected side is his right side, he will wear the PKG on his right wrist. This gadget detects tremors, which we learned before is involuntary movements, bradykinesia, which are slowed movements, and dyskinesias, which is excessive movements. Patients usually wear PKGs for 6 days while recording their own subjective interpretation of their symptoms on a PD diary.
Another piece of technology that's used for Parkinson's is called Google Glass, which is a pair of glasses that has built-in speakers. And with Parkinson's, one of the other common symptoms is freezing of gait, where patients will feel like they get stuck where they are and have trouble turning corners or continuing walking. And by wearing these glasses that have the speakers, it can help cue movements to try to prevent this freezing of gait.
¿Qué tecnologías hay en aparatos y dispositivos? Personal Kinetic Graph. Es usado en la parte del cuerpo que está más afectado por Parkinson's, digamos la parte izquierda, la parte derecha, y proporciona una evaluación continua y objetiva y ambulatoria de los síntomas tratables e incapacitantes de la enfermedad de Parkinson. Esto incluye, como dijimos al comienzo, los temblores, la bradicinesia y la disinesia. Y también hay otra tecnología o aparato que se llama Google Glass. Eh, Básicamente son gafas usadas para el movimiento. Usualmente lo que pasa con Parkinson es que las personas puede que tengan problemas de movimiento y usan gafas como el Google Glass.
So there are also some Parkinson-specific applications. So there are applications that can help learn about insurance and financing issues and medication. There are applications that can help you discover a good diet and exercise medication and over-the-counter medications that might help you. There are applications like Beats Medical, which can help with speech and language therapy virtually. And there are applications that help with your medication tracking, because with Parkinson's, one of the most important things is making sure that your medications are taken on time and you take the correct pills. So an app is a good way to help keep track of all of that.
¿Cuáles son los ejemplos de aplicaciones en el celular para la enfermedad de Parkinson? La primera, Parkinson Central, es utilizado para aprender sobre seguros y problemas de financiación, así como sobre dieta, ejercicio y medicamentos también. Es un directorio de recursos, por ejemplo, una conexión a un grupo de apoyo local. Segundo, tenemos Beats Medical Parkinson Treatment. Es utilizado para mejorar los problemas del habla y el lenguaje. También tiene un tratamiento diseñado para mejorar la coordinación y la destreza manual. Y tercero, Medication Tracker o Medication Log. Son dos aplicaciones recomendadas por la Fundación Michael J. Fox para ayudar a los pacientes a realizar un seguimiento de su régimen de medicamentos.
So moving on to some novel interventions in Parkinson's disease, the first being ultrasound light therapy, which uses MRI technology to locate the precise location where the overactive part of the brain is. Once that's done, they use ultrasonic waves to heat the tissue. Another being light therapy, which uses infrared waves, where studies have shown early promise that brain tissue treated by the infrared waves demonstrates success in having a protective effect on the neurons.
También hay nuevas intervenciones, como por ejemplo la terapia de ultrasonido enfocada de alta intensidad. Se usa para interrumpir el circuito anormal de la enfermedad de Parkinson en el cerebro. ¿Cuáles son las ventajas? Es una alternativa no invasiva a la cirugía de DBS con menor riesgo de complicaciones. También hay terapia de luz. Es una terapia orientada a la reparación destinada a estabilizar las neuronas defectuosas. Funciona mediante el uso de iluminación infrarroja para tratar el tejido cerebral afectado por la falta de oxígeno, entornos tóxicos o la disfunción mitocondrial. ¿Cuáles son las ventajas de esta intervención? Los primeros estudios demuestran que el éxito en la curación, protección y activación de diferentes vías neuronales y neuroprotectores.
So now we're going to dive into a little bit about research. So what exactly are clinical trials? Clinical trials are scientific studies conducted to find better ways to prevent, screen for, diagnose, or treat disease. They produce data for future healthcare decision making. So
Investigación de trastornos neurodegenerativos, que son los ensayos clínicos. Los ensayos clínicos son estudios científicos realizados para encontrar mejores formas de prevenir, detectar, diagnosticar o tratar enfermedades. Producen datos para la futura toma de decisiones de atención médica.
So clinical trials may involve testing a new drug or vaccine, testing a new medical device, comparing two different drugs or devices, or observing a group of people with a certain disease. So in this case, there would be no intervention. Clinical trials require approval from a health authority, such as the FDA, and or an ethics committee before being conducted.
Los ensayos clínicos pueden incluir probar un nuevo medicamento o vacuna para determinar la seguridad, eficacia y los requisitos de dosificación y los efectos secundarios del medicamento. También prueba de un nuevo dispositivo médico, comparar dos medicamentos o dispositivos diferentes, observar a un grupo de personas con una determinada enfermedad sin intervención, o los ensayos clínicos requieren la aprobación de una autoridad sanitaria como la FDA o un comité de ética antes de realizarse.
So now that we have a general knowledge about research, let's discuss the relationship between research and minority populations. There have been known barriers to inclusion of minorities in research, so such as the historical impact. There's been certain unethical studies done in the past. So for example, there was a syphilis study with African Americans where informed consent was not taken. And although adequate treatment was available, it was not given as well. There was also another study, it's a diabetes project with Native Americans, where individuals' DNA samples were being used in non-diabetes related genetic studies subjects did not consent to. In addition to the historical impact, there is the language and non-English speaker barrier, the access to care, and the lack of comfort in feeling safe and seeking care.
Se sabe que existen barreras para la inclusión de minorías en la investigación. Impactos históricos, historial de abuso médico y de investigación de ciertas minorías étnicas que ha afectado la participación y la confianza en la investigación hasta el día de hoy. Como por ejemplo el estudio de sífilis en Tuskegee con afroamericanos, no se tomó el consentimiento informado, no hay evidencia de que los investigadores les hayan informado del estudio y su propósito real. No se administró el tratamiento adecuado cuando estuvo disponible y no se dio la opción de retirarse del estudio. También hay proyectos de diabetes Havasupai con nativos americanos. Las muestras de ADN se estaban utilizando en estudios genéticos no relacionados con la diabetes. Los sujetos no dieron su consentimiento para la investigación, ¿no? También hay problemas con idioma o personas que no hablan inglés y el acceso a la atención, incapacidad para acceder a la investigación o no hay ninguna disponible y la falta de comunidad y seguridad al buscar atención.
So fortunately, such issues have been addressed through some regulations, such as the Declaration of Helsinki and the Belmont Report. It's also, these policies have guided changes to recruitment procedures, participant rights, informed consent policies, regulatory oversight, and the electronic transmission of personal health information. And just as a note before we move on, it's been acknowledged that we've been lacking representation, but we aspire to include non-English speakers in the future. For now, all current research studies at Cornell are done in English.
Mirando hacia el futuro, estos problemas se han abordado a través de declaraciones de políticas y un aumento de regulaciones, incluido el documento fundamental de la Asociación Médica Mundial sobre los principios éticos para la investigación médica con seres humanos, conocido como la Declaración de Helsinki, y las normas estadounidenses posteriores, como el informe Belmont, la regla común, y en menor grado por la regla de la privacidad en la ley de la portabilidad y responsabilidad de seguros de salud HIPAA. Estas normas han guiado los cambios en los procedimientos de contradicción, los derechos de los participantes, las políticas de consentimiento informado, la supervisión reglamentaria y la transmisión electrónica de información médica personal. También reconocemos que nos hace falta de representación, especialmente en el término de minorías en investigaciones clínicas, pero aspiramos a incluir en el futuro a personas que no hablen inglés. Por ahora, todos nuestros estudios de investigación en Cornell se realizan en inglés.
All right, so at Weill Cornell Medicine, we are strongly committed to conducting responsible and ethical research in our community and are guided by federal, state, and institutional policies, regulations, and procedures. We are dedicated to the advancement of medicine for all people, regardless of race, color, national origin, gender, religion, sex, including pregnancy, sexual orientation, gender identity, or transgender status or disability.
En Weill Cornell Medicine estamos firmemente comprometidos con la realización de investigaciones éticas y responsables en nuestra comunidad. Nos guiamos por las políticas, reglamentos y procedimientos federales, estatales e institucionales. Nos dedicamos al avance de la medicina para todas las personas, independientemente de su raza, color, origen nacional, género, religión, sexo, incluido el embarazo, orientación sexual, identidad de género o condición de transgénero o discapacidad.
All right, so before I continue, I see that you guys have a lot of questions in the text box. We'll address all questions at the very end. So please try to be patient with us, okay? So for right now, we're gonna be talking about some major technology-based protocols. Next slide, please.
¿Qué estamos haciendo el día de hoy en el Instituto de Enfermedades, Trastornos y Trastornos de Movimientos en Weill Cornell Parkinson? Llevamos a cabo múltiples ensayos clínicos enfocados en todas las etapas de la enfermedad de Parkinson. En esta parte de la presentación nos vamos a enfocar en los principales protocolos basados en la tecnología.
All right, so let's begin with the protocols focused on gadgets. First up is a study called ATLAS, which is a study that occurs over the course of 3 years that investigates the changes in symptoms and progression of Parkinson's disease. This protocol uses the personal kinetic graph, or the PKG, that we discussed earlier to track progression of Parkinson's disease over time. Specific main criteria for the study include age must be between 30 and 70. You must have a Parkinson's disease diagnosis within the last 3 to 12 years, and you must be currently on 1 or more Parkinson's disease medication.
Nuestros ensayos clínicos basados en la tecnología en Weill Cornell Medicine, vamos a comenzar con los dispositivos. El primero se llama Atlas. Es un estudio longitudinal que investiga los cambios en los síntomas y la progresión de la enfermedad de Parkinson. Este estudio observacional incorpora el uso del Personal Kinetic Graph, PKG, para rastrear la progresión de la enfermedad de Parkinson a lo largo del tiempo. ¿Cuáles son los requisitos? Edad de 30 a 70 años. El periodo del estudio son 3 años. Es un diagnóstico de la enfermedad de Parkinson de 3 a 12 años. Ha sido diagnosticado por la enfermedad de Parkinson en 3 a 12 años. Uno o más agentes dopaminérgicos y la amantadina, algunas imágenes y recolección de muestras.
The next study we're going to be talking about is called Neuroderm, where subjects will wear a pump very similar to the one shown in this picture. It's like a diabetes pump. And with Parkinson's patients, when they take their medications, they feel an initial surge of the medication working for them. But eventually it will wear off before their next dose. And this wearing off time can become very unpleasant. So this pump, the goal is that with a constant infusion of the medication, it will limit the amount of wearing off time. In order to enroll in this study, you need to be 30 years or older. The study lasts about 40 weeks. You need to have a diagnosis of Parkinson's with significant amount of the off time, which is the time where you feel like your medication isn't working doses. You also need to be on at least 4 doses per day of your Parkinson's medication, and it does involve some blood collection.
En el término de dispositivos tenemos Neuroderm. Es un estudio doble ciego para determinar los efectos del fármaco de infusión del estudio sobre la enfermedad de Parkinson para limitar el tiempo que se pasa en estado inactivo. El fármaco de infusión del estudio se administra mediante un dispositivo de bomba externo. ¿Cuáles son los requisitos? En la edad 30 o más, un periodo de estudio de 40 semanas, un diagnóstico de la enfermedad de Parkinson con cantidades significativas de tiempo libre, debe tener 4 dosis diarias de levodopa y también hay alguna recogida de muestras.
The next thing we're going to be talking about is Weill Cornell's own smartphone application called MyCap. And this study is open to both people diagnosed with Parkinson's disease and people who are healthy controls. And this study, you will download an app on your phone, and twice a day, once when for Parkinson's patients they're on their medication, and once when they're off, they'll go in and they'll do a tapping exercise on the phone. And the goal of this is for physicians to eventually to be able to see whether or not their medications are working correctly for them. There's no age criteria for this study. As I said earlier, you can be a healthy control or diagnosed with Parkinson's, and you need to have an iPhone.
Una de las aplicaciones para teléfono móvil se llama MyCap, parte de ensayos clínicos. Es un estudio para probar si las tareas activas completadas en una aplicación de teléfono inteligente son efectivas como medida para recopilar datos de pacientes con enfermedad de Parkinson. ¿Cuáles son los requisitos? No hay criterios de edad. Puede ser un control saludable o diagnosticado con la enfermedad de Parkinson, pero debe tener un iPhone.
So here at Cornell, our department is running a study along with the neurosurgery department with Dr. Michael Caplet called Focused Ultrasound Therapy Exaplate. It uses MRI technology, like I said before, to map the exact area of the brain to then target that area with the ultrasonic waves to heat the tissue, which will then decrease the activity of the neurons in that location. Some current studies include patients with Parkinson's disease. There's another study that has patients with essential tremor, and this technology is also being used in a clinical trial for patients with Alzheimer's disease. For more visual aids and videos on how the procedure is done, a great resource is the Weill Cornell Brain and Spine website, which link is here on the screen.
También hay intervenciones novedosas como la terapia de ultrasonido enfocada, Exablur. Se utiliza un ultrasonido de alta intensidad para eliminar de forma no invasiva la fuente de temblor en pacientes con enfermedad de Parkinson. Un gran recurso que dice cómo se usa en el link presente. Es un tratamiento realizado como procedimiento ambulatorio. Aproximadamente 3 a 4 horas se toman tomografías computarizadas y resonancia magnética funcional para mapear el área del cerebro.
Another study using light therapy that we're conducting is called Enlight-PD, and this is for patients who have both Parkinson's disease as well as difficulty sleeping. Subjects will be enrolled for a 16-week-long period where participants will be responsible for keeping a sleeping log, which will be provided to you by the study team, wearing a device called an ActiWatch, which measures light exposure, as well as sitting in front of a light box, similar to the one you see on the screen, for 60 minutes, once in the morning and once at night. The goal is that this light therapy will help regulate your sleeping patterns.
También hay terapia de luz. Enlight-PD es un estudio ciego para evaluar el efecto de la terapia de luz sobre los problemas de sueño debido a la enfermedad de Parkinson. ¿Cuáles son los requisitos? El periodo de estudio son 16 semanas, diagnóstico de enfermedad de Parkinson, horario de trabajo regular o jubilado con viajes mínimos y es para problemas de sueño debido a la enfermedad de Parkinson.
All right, so let's start wrapping up. If you're interested in learning more about any of the studies, feel free to contact for Atlas, myself, or Natalie. For Enlight PD or Exaplate, please contact Gabrielle. And for Neuroderm and MyCat, please contact Samantha.
Está la información de contacto. Si desea tener más información sobre alguno de los estudios, comuníquense con Mesa para Atlas o Natalie para Atlas, con Gabriel para NYPD y Exablade, y con Samantha para Neuroderm y MyCap.
Okay, so now we reached the end. If you guys have any questions or comments, feel free to ask it, or you could type it into the chat box. I know there's several questions in the chat box that we'll address right now. Before we do that, I just would like to thank everyone for attending today's seminar, and we would hope that you guys will join us for any future broadcasts.
Besides that, we also have a poll, so if you can answer it, it will be done anonymously. Si tienen algunas preguntas o comentarios, lo pueden usar el chat, la función de chat en la parte de abajo. Gracias por participar en nuestra presentación del día de hoy. Estén atentos a nuestra próxima transmisión. All right, so there's a couple of questions. I am going to go ahead and let's go with the first one. It says from Karina, I'm finding all these tools very interesting, but all these seem to be for use by the patient. My dad is newly diagnosed and will not be able to manage any of these himself. There has been little improvement in his condition and needs full-time care.
Massachusetts, but the daughter lives in Jersey. Oh, I'm sorry.
I'm going to stop sharing our screen for the moment. And so I guess we'll just go through each question by question, right? Well, Kenny, the poll is still going, right? Just to make sure.
Yes. It'll be in the background, yes.
Okay. So actually, to address that question, it actually may be difficult to ascertain how eligible a person is in a research study. So although, it may seem it could be difficult, there are definitely lots of barriers to why a person, may or may not be a good fit. But I still wouldn't hesitate to at least reach out and clarify. Again, even if we think about like a lot of our current studies, you do have to at least come in physically to the clinic to get started. And then there are all these features that happen at home. So to answer that question, and we could actually take this offline to really be more precise, to talk about, eligibility versus non-eligibility.
And the next question is, can you give us some detail on light therapy? I'll say it in Spanish. ¿Nos puede dar detalles en la terapia de luz? Sobre la terapia de luz.
So Natalie, I could answer this question. The current study we have for Enlight PD is basically you'll be given 2 of those light boxes and you'll just be asked to sit in front of it for 60 minutes 2 times a day. So 1 in the morning, 1 at night. And the goal is that your exposure to this light will help regulate your sleeping patterns. So as of our research at Cornell right now, that's all we have offering. I don't know if it's completely answering your question at the moment.
The next question is, you say the disease is progressive. Isn't there a way that with combination of drugs and other methods that the disease can be stopped from progressing or even reversed? I'll also say in Spanish, hay una combinación de drogas o medicamentos que se pueden usar para detener el progreso de la enfermedad o revertir la enfermedad de Parkinson.
I really appreciate that question, right? Can the disease be stopped from progressing? And even more so powerful, can we reverse? So that's really what a lot of researchers are looking at. The studies that we presented today that are technology-based do focus to some extent on some intervention, though not necessarily stopping. I guess we could think about exablate in the sense as far as stopping that, you know, there is a lesion that's created, right? So that's an actual intervention on the brain. But as far as, you know, stopping and then reversal, this is still a major aim that, you know, as scientists, we look to the future and hope to do. And right now the speculation, and, you know, this, I'm speaking on behalf of the multitude of doctors and scientists that are working with us at Cornell, and clearly, you know, throughout the greater, you know, other scientific institutions that are looking to do this as well, that it's probably not just going to be one thing that necessarily stops the progression, especially if we're looking at the many causes. We just lightly touched on the possible causes of Parkinson's. That would be like another topic, another presentation in and of itself. So the studies that we broached on today looks more at the treatment with, right, the management with the condition, but not necessarily stopping it in its tracks. Again, that's a wonderful aim, and something that I think many scientists hope to do in the future.
Para esa pregunta, en el presente los investigadores están tratando de encontrar formas para detener el progreso de la enfermedad o hasta revertir la enfermedad. The next question is, are treatments and analysis for Parkinson-like disease the same as what you're describing here for what appears to be traditional Parkinson's, or are there different approaches for Parkinson's-like diseases? ¿Son los tratamientos o el análisis de la enfermedad de Parkinson similares a la enfermedad de Parkinson o son diferentes los tratamientos?
So again, this is another great question, possibly food for thought for an entire additional conversation. We are looking at idiopathic Parkinson's disease, right? So what fits the criteria for the diagnosis of idiopathic Parkinson's? Knowing that Parkinson's is very complicated, right? In my early slide in the beginning of this talk, we mentioned how there are many motor symptoms, as there are many non-motor symptoms, and the condition is very unique. So people do present differently. The current studies do look at idiopathic Parkinson's. Now, has there been situation where people have been diagnosed, and as the time goes on, perhaps their symptoms start to look a little bit different. And then we start to wonder, is this atypical Parkinson's? And that's actually why a true biomarker is still necessary to help us better diagnose this.
The next question is Parkinson hereditary? Is there a genetic testing that will help to actually check for Parkinson's disease? ¿Hay un test genético para ver si una persona tiene Parkinson?
So I'm going to answer that question, but again, if anybody wants to chime in from our research coordinators. So we do have genetic testing that's available. And again, it depends on the condition, what is being looked at, and really what the endpoint of that is. Again, we didn't cover this in this talk, but one example would be the GBA mutation, which is a genetic test. It's actually something that we are currently offering at Weill Cornell. And because there's another trial going on right now that actually encompasses looking at GBA mutations, again, that could segue a person from possibly being enrolled in other types of clinical trials. And again, this is where precision medicine comes in, where we could possibly help to delineate different types of Parkinson's, sort of related to what the question was asked of earlier, right? The idiopathic Parkinson's versus right? If we have this big umbrella definition of Parkinsonism. If anybody would like to add to that from my research coordinators, please do so.
Natalie, thank you for your explanation. And just so everyone knows, we are still enrolling for our GBA genotyping study. So if you would like to have that done, you can feel free to reach out to me via email or phone call. And just so everyone knows, it's not a full comprehensive genetic test. It's really just to see if you have a mutation in your GBA gene.
This is just a little comment. If you can't submit the poll because you can't answer question number 6, just pick any of them. That's okay. It doesn't matter which one you pick. Just pick any of the answers and submit. Thank you. Let's see what else. We have a couple more questions. Okay, is shortness of breath a Parkinson's symptom?
So if a person comes into the clinic and says they have shortness of breath, most likely the clinician first thing will think about, okay, is this an issue that's pulmonary or lung related? Is this an issue that's cardiac related? Or is it something else? So shortness of breath by itself can stem from so many different things. Do we see this in Parkinson's? We do. We see that when a person becomes more bradykinetic or slower, right? So when they become slower, sometimes they're not able to expand their diaphragm as much when they're breathing, right? Because to breathe well, it does require muscle movement. And also when there are dyskinesias, sometimes a person, they may have these involuntary movements where it actually affects how well they're able to take in breaths. And shortness of breath is quite commonly reported between doses. So when a person finds that they're wearing off, right, their medication is running out, they actually might start to feel a little bit short of breath. Again, it's a real big symptom. It can come from so many different things. So the appropriate way to approach it would be to rule out everything else and make sure that it's not coming from some other organic type of issue. But yes, it is seen frequently with Parkinson's.
Next question is, any thoughts on managing dystonia and Parkinson's?
So dystonia, so I will take this question as something that maybe we should cover for a future talk, right? Because dystonia and Parkinson's, there's a wealth of information that's related to that. And I will say, actually, one of our physicians at Weill Cornell, Dr. Harini Sarva, is a real dystonia expert. So perhaps in our next talk, we can ask if Dr. Sarva can join us, and we can have a presentation on this. Again, if you'd like to contact us offline, I do not have a short answer for this question. There's a lot that a person can do to manage dystonia and Parkinson's.
And I think there is one more question, and I think this should be the last question. What is Parkinson's plus?
Parkinson's plus is the definition of, as I mentioned, there is the umbrella term of Parkinsonisms. So Parkinson's plus refers to an atypical Parkinson's, something that might look like idiopathic Parkinson's disease or classic Parkinson's, where a person actually has a response to levodopa, but it actually turns out to be something else. Again, this requires a real solid neurological evaluation and oftentimes monitoring over time. So some of the Parkinson's plus or atypical Parkinsonisms that we are aware of includes cortical basal degeneration, includes multiple system atrophy, or parasupranuclear palsy. So these are other rare neurological conditions that exist. They mimic Parkinson's, but they're actually rather different. They have a very different pathophysiology. And while the treatments, they're sort of borrowed from Parkinson's, they have a different trajectory. And that is what we refer to as Parkinson's plus or atypical Parkinson's in the literature.
And I think that was the last question. Thank you so much.
Oh, I know we're at time. I see Dr.
Oh,
Linda
yes.
Novobi, thank you so much. You have a comment. This is great. Again, a learning point, right? In general, 5 to 10% of Parkinson's disease is genetic or hereditary. The rest are considered sporadic. So that's a great point to make. So thank you for adding that to this talk.
Okay. That was the last question. Thank you everyone for joining us today. Muchas gracias por atender el día de hoy nuestra presentación. Thank you, Mesa. Thank you, Samantha. Thank you, Natalie. And thank you, Gabrielle, for joining us today. Hopefully, everybody has I hope everyone has a nice day. Bye-bye.
Thank you, everybody. Thank you for joining. Thank you, Kenny, for doing this with us.
Bye,
Take
guys.
care.
Take care.
Until the next time.